Triad Healthcare Network has engaged Emmi Solutions to support teach-in practices with patient engagement tools to improve health outcomes. Emmi Solutions is a healthcare communications company focused on empowering individuals to take a more active role in their care. I'll cover over the next few minutes basics about Emmi and the 3 solutions patients and practices will get the opportunity to use: Emmi Prevent, Emmi Engage, and Emmi Transition. I'll also give a quick example of how Emmi can be used and finally highlight the opportunities for using Emmi support solutions. For now, let's watch a brief video about Emmi Solutions.
Managing a population's health means more than helping people when they're sick. It means driving behaviors that will keep them healthy. But the resources required to do this effectively are often in short supply. And that's where we come in. Whether it's closing gaps in care, driving preventative screenings, or scheduling appointments, our automated phone calls help healthcare organizations drive action across their entire population. Emmi can personalize each call and deliver a customized message based on an individual's needs.
Hello, I'm calling on behalf of Community Health. Is this Mary Smith? Yes. Great. I'm calling because our records show you need a cholesterol check and an A1C check. Would you like a bit more information about why they're important? Yes.
Using the same friendly voice and style found in our award-winning multimedia programs, Emmi helps people understand the importance of taking action and gives them a chance to take the next step.
Diabetes puts a lot of stress on your body and heart. Regular checks help your doctor catch any issues early when they're easier to treat. So how about it? Can I help you schedule those tests? It'll just take a minute. Yes.
Emmi tracks, documents, and reports on the success of each call and ties every interaction to the outcomes that matter most. And best of all, Emmi is really easy to use. You identify the people you want to reach, we take care of the rest. And it's designed to complement your workflow. Emmi has the flexibility to operate independently or integrate into data analytics, EMR, or other clinical systems. Whether it's a population of a few hundred or a few 100,000, we work with you to create scalable outreach and make every interaction meaningful. Emmi Solutions, engaging populations, driving action, and improving outcomes.
Emmi Prevent combines the efficiency of automated calls with the effectiveness of Emmi communication to promote patient actions for prevention. Examples could be reminding patients that it's time for a visit, that a diabetic eye exam is needed, a reminder for mammography, and even flu and pneumonia vaccine reminders. Emmi Prevent provides scripted calls to patients that will appear to come from their providers and will ask for patients by name. Patients could be simply reminded of a needed service and have the ability to note a date when that service was completed. And when appropriate, the patient can be transferred through to the provider's office to schedule. Emmi Prevent helps patients understand the importance of taking action and gives them the tools to do so. Emmi Engage supports office and bedside education with interactive programs delivered over the internet and printable materials at the point of care. Emmi Engage helps practitioners overcome health literacy and issues keeping patients engaged by offering simple-to-follow videos that teaches patients about their condition, how to make healthy choices, and how to manage their care. Examples include smoking cessation, hypertension, COPD, or recovering from knee surgery. Hospitals or practices using Emmi select education videos they want patients to view and can arrange for them to watch those videos in the hospital room, in the practice office, or even send a link for patients to view videos at home. Statistics are clear that readmissions are likely following a discharge. In fact, on average, 1 in 5 Medicare beneficiaries discharged from the hospital is readmitted within 30 days. Through automated interactive calls, Emmi Transition can reach out to our high-risk populations, such as those with recent hospital discharges. Transition calls deliver patient-specific health messages and ask how the patient is doing after that discharge. Emmi Transition calls can collect information about follow-up appointments, taking and understanding medications, and signs of problem symptoms. And when concerns arise, Emmi will report the responses to the healthcare team. Patients often receive care and information related to that care at multiple points across the healthcare system. Lots of variables impact whether a message is given, received, or understood. Emmi Solutions offers teach and tools to keep messages consistent across the health system and goes as far as to extend into the patient's home. Emmi allows us to engage patients with personalized health information. Teach-In offers Emmi Solutions free to practices. The resource assists with closing metric gaps, such as screenings or vaccinations, on a large scale by reaching out to a significant volume of people during a campaign. Emmi helps us promote population health. Emmi encourages access to care, reminding patients of new healthcare interventions, and prompts them to schedule follow-up, such as diabetic eye exams, labs, or vaccinations. Emmi educates our patients without time constraints. Patients at their own pace can view Emmi Engage videos to learn more about self-management. Emmi follows our patients across the continuum of care, hospital, practice, or even home. And Emmi helps us to uniform the message. And finally, Emmi education can be shared with patients' loved ones so they can learn too how to recognize signs and symptoms of exacerbations. 2014's flu campaign is a great example of how Emmi Prevent works to support patients and practices. During this campaign, Emmi Prevent called low-risk patients, non-elderly and without chronic conditions, who did not have documentation of receiving the flu vaccine. The calls aimed to reach just over 23,000 people across the system to ask, have you had a flu vaccine? And if not, encourage them to get one. 8,800 calls engaged patients, and an additional 10% received voicemail messages with those simple reminders. Nearly half, or just over 4,000 patients, reported the month that they received the flu vaccine. This meant that nearly 18% of the gaps in care for flu vaccine were filled with a single Emmi campaign. A separate campaign was also conducted in 2014 to contact over 4,800 of our highest risk patients, those that are over 65 with congestive heart failure and/or COPD. During the call, patients were asked if they had received that flu shot, and if so, to report a date. And patients who reported needing a flu shot were given the option to be transferred through to their physician office to schedule a vaccine appointment. From that high-risk flu call, just over 2,000 patients were engaged, and 24% reported having a flu shot. 180 of the patients requested to be transferred through to their practice to schedule an appointment. That means you and your practice were there to assist high-risk patients in getting a much-needed preventative service. THN is excited to provide 3 Emmi solutions: Emmi Prevent, Emmi Engage, and Emmi Transition. All are interactive and personalized tools to support your patients. This fall, several Emmi Prevent campaigns will begin. A more detailed calendar will be provided to your office before the campaigns begin. We expect that diabetic time for a visit calls will occur in August. Diabetic eye exams and general time for a visit calls will occur in September. Flu reminders will also occur in September, and additionally, dates for colonoscopies and mammograms will occur this fall. During the campaign, patients will receive personalized Emmi Prevent calls that will appear to come from their provider's office. Patients may simply be reminded of a needed service and have the ability to provide a date if and when that service was already completed. And 2, patients can select to be transferred through to their provider's office to schedule. Remember, Emmi Prevent helps patients understand the importance of taking action and gives them the tools to do so. For practices handling calls, dispelling any confusion about receiving calls, and scheduling needed follow-up for patients is where you come in. If you have additional questions, feel free to connect to either of our Emmi project managers, Noreen Tamburino or Tonda Gosnell. Thank you for taking time to view this presentation, and most of all, thank you for being there for patients.